My name is Lauren Cavanaugh, and I am a physical therapist here at the University of Maryland, St. Joseph Outpatient Rehabilitation Institute, and I focus more on treating patients after they have a neurologic injury. I treat patients that have had some kind of neurologic event, such as a stroke or Parkinson's, or even a vestibular issue. So it's different from like the orthopedic patients in that it's not based specifically on strengthening and range of motion. There's a lot more functional tasks. Neuro rehab encompasses a bunch of different patient populations. So we see people after a stroke, sometimes a very recent stroke, sometimes it can be something that was like 15 years ago and they're having more difficulty moving around after the fact. We also see patients with Parkinson's, a functional neurologic disorder, balance issues. Sometimes people have polyneuropathy, so they're having trouble maintaining their balance, and also vestibular issues as well, so dizziness and difficulty moving around without being nauseous or dizzy. So when somebody needs neurologic physical therapy, they will get an order from their doctor, and it can be anywhere from weakness or their actual medical diagnosis such as stroke or Parkinson's. And then their first visit's typically an hour, so we'll take a look at kind of everything, your strength, your balance, the way that you're walking or transferring, and asking you what your goals are. So not everybody's goal is to walk around the block. Some people just want to be able to stand up by themselves. Other people want to get back to running. So it's very patient specific as far as what they want to get back to. And then we'll come up with a plan as far as how many times a week that they need to be seen. So some people are 2 to 3 times a week, some are once a week. Or we also have the big program, which is 4 times a week for 4 weeks as well for patients that have Parkinson's. So some of the goals for patients with neuro rehab are basically getting back to their prior level of function. So a lot of times these people come in and it was kind of an acute disruption of their life. So a week ago they were walking, doing everything on their own, and then they have a huge stroke or another vestibular impairment that really takes a big toll on their life, and they require a lot more assistance to do everyday things that most of us take for granted, such as walking, getting in and out of bed by yourselves, walking up and down the stairs. So I have some patients that come in and their whole goal is to get back to walking, but I also have higher level patients that want to get more strength and control and get back to running or back to playing sports as well. So I enjoy seeing the patient populations that come in here and working with the neuro population because I feel like they work really hard to get back to where they were before any of this happened to them. So it's very rewarding to see somebody come in a wheelchair, for example, and when they're finished therapy, they're walking out with a cane or able to walk with no assistive device and get back to the things that they used to do before any of this occurred. Here at St. Joe's, it's a very nice, tight-knit group of therapists, so I think we do a good job at treating individually, but also kind of communicating between each other to get the max benefit for the patient. Each month we have a meeting specifically that's interdisciplinary through the movement disorders, so PT, OT, speech, as well as a neurologist, all kind of chit-chat and figure out what's best for the patients at hand, which is definitely not the norm for most therapy clinics, but it definitely helps all of us, I feel like, help those patients get back to where they were before.